Welcome to the launch of the 9th annual Spirit of Mother Jones Festival, which will run through this Monday. If you look in your question and answer stream, that's your way to interact with the panelists and ask questions, but it's also a way for us to announce things. So you'll see in there that there's some information on an upcoming event tonight at 7:30, as well as the rest of the program. And you'll also have an opportunity to ask questions of the panelists. Now, the one thing that we ask is if you already see a question, the question you had in mind has already been asked, just give that one a thumbs up, because we'll be looking for, to combine, the questions that are asked the most, and those will be the first ones to be asked of the panel. So to kick things off, I'd like to read a letter that came to us from the President, Michael D. Higgins, the President of Ireland, and to help us launch the festival. And he says, "May I send my best wishes to all those involved in organizing the 2020 Spirit of Mother Jones Festival, as well as those attending the event. This year we gather together virtually with our fellow workers across the globe to mark the 90th anniversary of Cork-born Mary Harris's death on the 30th of November, 1930. In this significant moment of the labor movement, we can identify moments when a single individual became a catalyst for positive change. Mary Mother Jones is one such figure. Among those emancipatory figures to whom we owe a great deal of gratitude, she was a survivor of the Great Famine, the yellow fever epidemic of Memphis, the Great Chicago Fire of 1871, which robbed her of home, family, and livelihood, as well as the so-called Spanish flu pandemic of 1918 and 1919. Mother Jones was a woman of enormous grit and vigor. Yet despite the tolls of such personal struggle and tragedy, she found and mustered the resolve that enabled her to contribute so much to the labor union of the United States over a period of several decades. We gather at a time of unprecedented risk for those who work tirelessly and selfishly in our health services, those who endure the continued delivery of essential services and utilities on which the citizens depend. Your conference is taking place as we face the challenges of dealing with a pandemic that is having such devastating personal, social, and economic consequences. However, out of such a crisis, we are presented with perhaps a once-in-a-generation opportunity to do things better, to embrace and bring to fruition a new paradigm of existence with each other. In relation to working and living, and with the world itself, a renewed and healthier symbiosis of society, economy, and ecology. The pandemic provides an opportunity to rethink the connections between climate neutrality, a sustainable economy, social welfare, and labor itself. The appropriate role of Mother Jones would seek for the trade unions, the labor movement, and egalitarians of every hue is working together to give a lead. Work, above all else, is a human activity, and given that in its form, conditions, and purpose, must have the participation, thought, design, and sense of collectivity that comes from being a trade union member and activist. Let us today commemorate the many thousands around the world who have, through their generous and willing efforts in the service of others, lost their lives to COVID-19, giving their families for others for whom they shared the public world, giving their lives together for those who they share the public world. Let us remember and celebrate also the many thousands more who continue to put their lives at risk in order to continue their important work that is for the benefit of their fellow citizens. To all those workers who have responded to the coronavirus with such generous spirit of solidarity, we owe an enormous debt of gratitude. However, gratitude, whose expression is so important, cannot be and must never be perceived as any adequate substitute for the dignity, well-being, and security of employment, which is the right of all workers in a fair and inclusive society for which Mother Jones fought so tirelessly. As we navigate our way towards a shared and better future, We must resolve to build a lasting memorial to those brave and selfless workers who have been so easily left out of the pages of history. Let it be our battle cry too, that battle cry of Mary Mother Jones, and the motto that lies at the heart of this important day. Remember the dead, but fight like hell for the living. Today, as we reflect on the dynamic role of trade unions in the wake of the pandemic and the safekeeping of our frontline workers, let us all commit to continuing our appreciation by standing in solidarity with all those who contribute in so vital, their contribution is so vital during this difficult time, recognizing and enabling their right to protection, to be represented, to participate, to job security and decent working conditions now and into the future, where work will, in an enduring way, be recognized for the enriching human activity that it can be and must be post-pandemic society, to be a version of a world of work that prevails. I wish your festival every success. Bear Bannock, Michael D. Higgins, Utaran Nairan. And now I'd like to share with you a brief video that the Lord Mayor of Cork has contributed to help us launch the event. And so now I'm going to switch to this video.
Hello, I'm delighted to welcome you all to the 2020 Spirit of Mother Jones Festival. This festival is a regular event on Cork's festival calendar, and now, like so many other events, it has had to move online this year. However, the organisers have still managed to pull together a great line of events, which are a mixture of talks, screenings and musical events. It's all kicking off today, and this opening event, entitled The Dynamic Role of Labour Unions in the Wake of COVID-19 and the Safekeeping of Frontline Workers. This is a partnership event between the Spirit of Mother Jones Festival and University College Cork Civic Engagement. It is a live-streamed panel discussion which will feature labour union leaders in Ireland and highlight the challenges posed with regards to ensuring workers' safety. Panelists will also consider how the global pandemic will reframe issues of labour rights and workplace safety over the next decade. It promises to be a most interesting discussion, and I would like to wish all attending this event and the other events planned in the coming days all the very best for a successful festival.
Okay, and now we're officially launched as a festival. So what I'd like to do is take no delay and to introduce our panel of experts for this afternoon's event, which includes Ann Piggott, who is the current president and the Association of Secondary School Teachers. She's the current president of the Association of Secondary School Teachers of Ireland, and is herself a teacher of maths and English. Phil Hay, who is trained intensive care nurse and general secretary of the Irish Nurse and Midwives Organization. Dr. Edward Lahiff is a lecturer of international development studies at UCC. He is currently the chair of the UCC branch of the Irish Federation of Union Teachers and is a member of the IFUT National Executive, and he will be serving as our panel moderator. So now I would like to hand over the floor to Dr. Edward Lahiff.
There you go. The perils of online life. Thank you, John, and apologies. It's great to be here this afternoon in such august company and have those messages of support and solidarity from Uachtaráin na hÉireann and the Lord Mayor of Cork. So it's my very pleasant duty to welcome, as John has also done, our two keynote speakers today. Phil Hay, General Secretary of the INMO. Phil is well known to us as a prominent union leader, a prominent spokesperson for not just for the health sector, but for all that is going on, the challenges we face across our society. And Ann Piggott, who is president of the ASTI and herself a teacher. I think we could not ask for better representatives of the challenges that we face. These two key sectors that are so important to us, and really representing the front line of this struggle. I'm not sure if university lecturers can claim to be quite in the front line to the same extent, but we're all part of the same movement, and I'm delighted that we can be involved and that UCC can be involved in this. So I think without much further ado, I would like to give each of the speakers 10 minutes to present on this important topic of the role of the unions at this present time. And I think we will, as I understand it, we will start with, go to Anne Piggott, please.
Okay, thank you very much. And I want to thank John for inviting me to speak, and I want to thank Ciara, who's working behind the scenes. As a member of the committee, it's a pleasure to be here as a speaker. And it's good to see the Lord Mayor. Normally every year I have a path worn into the office to Nicola to arrange the Lord Mayor to come physically to the meeting, and unfortunately it's online today. But the advantage is at least we can have speakers, or we can have listeners all over the world who might be tuning in at the moment. So I just want to begin with Mother Jones' trip, really. She left Shandon and went to America many years ago, and we just saw John Bremo there, who did the opposite. He left America and came to Shandon, and though a much meeker character than Mother Jones herself. And we've heard her phrase over and over again, pray for the dead and fight like hell for the living. And in a way, I think that's what the ASTI has been doing since the summer. We have been fighting for the living, because our job really was to make sure that schools opened safely and the teachers and students would be safe in school, and subsequently that their families and parents and elderly relations would be safe at home. Before the summer, we engaged in remote learning. Schools closed very unexpectedly, really, on Thursday at 6 o'clock, and the following day was the 12th of March, and schools didn't open again until late August. And during that time, teachers engaged in remote learning with no experience, no practice, no equipment except for their own. But one of my best classes, as was mentioned in the introduction, I teach maths and English, and I also teach CSPE, which is Civic, Social and Political Education. And one day I had an English class, and soon after it, a CSPE class, and it was near May Day. So my class centred around Mother Jones herself, and I gave them 2 chapters, one in each class, from Mother Jones' autobiography. And if you haven't read the book, it's excellent. So I gave them the first chapter, which was about her life, where she claimed she was born in 1930, but it would appear she was actually born in 1937. And I asked them questions, and it was quite interesting for the first time ever when I spoke about Mother Jones. I think the students could understand life in Mother Jones' time better than they ever did before, to the extent that they recognised that schools were closed in her time with yellow fever, churches were closed. She spoke about the people dying, her own children dying, and the death carts just as well. And I think the students could really understand that, because at the time we saw trucks, army trucks in North Italy carrying the coffins, which was quite a horrendous time for everybody. And further on in her book, Mother Jones spoke about her love for the working class, love for the poor, and then she spent her life fighting for them. I also gave them the chapter on the March of the Mill Children, which was chapter 10 in the book. And I think my students at 13 and 14 years of age who were at home, who didn't leave the house, who couldn't even go to the shop for several weeks, when they read about the March of the Mill Children, it's probably sounded quite exciting. Children marching right across America with Mother Jones. They were fed, they had fun, and all of that was to expose child labour. And then that led on to interesting classes on child labour. So teachers did remote learning. It wasn't ideal to the extent that homework was coming in all night long separately from hundreds of students, and then classes had to be prepared for the next day. And even now in classes, because that's the way teachers communicated with students. Teachers are telling me that at 5 o'clock in the evening currently, they might get a message from a student saying, I didn't understand what you did today in class, will you explain it to me now? And then at 6 o'clock, they might get another email from the same student saying, you never responded. You need to help me to do my homework now. So life has changed very much in classrooms since then. And we spent all summer in a way preparing schools to go back. Furniture had to be removed so desks could be spaced out, so there would at least be 1 metre between students and 2 metres from the teacher. Staff rooms in some schools are gone, they just don't exist, or staff rooms changed into smaller rooms to be broken into maybe 2 classrooms, so as the spillover of students who wouldn't have fitted in one room created extra classes. So schools are very different in that teachers previously would have had their own classroom. Now teachers move around and students are in the room. The ASTI insisted on students wearing masks for protection, and that seems to have worked. All students wear masks and teachers wear masks. Teachers try and stay 2 metres back if possible. Classes are cleaned in between and after school. There has been enhanced funding for cleaning. A lot of money was made available, and a lot of schools threw out double desks and replaced them with single ones. And a lot of money was also spent on hand sanitizer, and that was quite expensive. And that also created extra problems. Even during the midterm or coming up to the midterm break, one particular sanitizer was deemed to be dangerous. So principals and caretakers and staff had to spend a few days replacing the sanitizer. And then after midterm or during midterm again, there was more problem with other sanitizer that weren't licensed properly. So all that had to be changed. Timetables in schools were changed. A lot of classes now run to 1 hour, and that saves a lot more moving around. So instead of 9 classes a day, there may be 6. Staggered starts and staggered lunch times have replaced classic timetables where everybody would have been on lunch together. And the whole idea would be to separate students from each other to stop spread of a virus should it erupt. Teachers themselves were very, very worried going to schools. They were worried that somebody in the class would be positive or might be a carrier of a virus and they mightn't exhibit any symptoms themselves. Those fears still exist, but at least we know that there aren't huge numbers and huge outbreaks, even though we did hear of one last night, and I'll talk about that again in a second. We also as a union worked on parent-teacher meetings so as that we wouldn't have the traditional face-to-face meeting, again with hundreds of parents coming in. So now they can be on Zoom or reports can be written or telephone calls can be made. We also didn't want huge assemblies with students where we might have 200 maybe in a particular year group. So now we may have Zoom meetings for staff meetings, Zoom meetings for parent-teacher meetings, and assemblies do not take place. Students are addressed in their classrooms. In the middle of all of this, because a lot of members in my union did not feel safe, our Central Executive Council decided that they were going to ballot members on health and safety issues, and a lot of those ballots were carried. So now we have a mandate for strike action should it be needed. And we were worried about close contacts, because when a positive case was identified, teachers were worried that there wasn't enough follow-up and close contacts weren't identified and weren't sent home. That was our feeling. We were also worried that we would have liked serial testing, we would have liked protective equipment, and we would have liked laptops provided in the event of students who might have been sent home. Since then, health teams have been deployed and made available for schools. We have had weekly meetings with NEFID and with the DES. We are getting now weekly breakdowns of figures and numbers of cases being recorded in schools. It was 56 the week before and 40 outbreaks last week in schools. Schools have direct phone numbers that they can contact public health should the need arise. But things still are not perfect. And one example is the school in Cork yesterday, which the story broke, where there were 17 positive cases. And this is one of the first schools to close in the way that it did for 2 weeks. And this is safer, and we are glad for the health of everybody that this has happened. But again, had there been better contact tracing and more serial testing, then that might have been avoided. We have school inspections now where traditional subject inspectors now go in and do checklists on schools. These are currently pilot schemes and will become proper inspections after Christmas. There is a checklist and signage, mask wearing, social distancing, and so on are being checked. Now, one of the questions that I was asked here today is, what is my vision for unions in the future following this, and what might change in the future? So I can be a realist and I can spell it out as I think it's really going to be, or I can be an idealist and say what I think I would like to happen. And I would like the small classes to continue. We've been looking for smaller classes for years, and now classes in a lot of schools have gone from 30 to 24, and extra teachers have become employed. That is me being an idealist. I imagine when this pandemic is over, that things may go back to normal. And again, we will have overcrowded classrooms with no investment being spent on schools. I would like students spread out. It makes discipline better, and maybe group work again in the future when that is feasible. We would like continued investment in education to the extent that it's being done now. There has been an OECD report which said that Ireland is 36th out of 36 countries for investment in schools. However, when we go back to normal, we may find ourselves, as I say, in not great conditions, with not a lot of investment in schools, not a lot of consultation with teachers on changes. I think also this epidemic has proved that the Leaving Cert exam is a wonderful exam. It is fair, it is impartial, and likewise so is the Junior Cert. We would like those exams to remain in the format as they are. Now, we don't mind content change and we don't mind reviews, but the idea of an impartial, fair exam is what everyone wants. And I think everybody is in agreement on that. Students, parents, teachers, teacher unions, Department of Education, we all want this. We trust the system. We trust the standardised method that's involved in it. It has always been recognised internationally as an excellent exam, and we don't want a huge overhaul. So in the future, maybe there is room even for remote work in certain ways. Again, teachers are quite happy to be at school, quite happy to be working and engaging with students. But as we've said consistently for the past few months, there is anxiety and there is stress. Teachers are moving around non-stop. They have to bring everything with them. I'm told that they're moving around schools with little wheelie bags and wheelie cases, whereas previously if students came into your room and they missed books, you could give them out books, and it just made everything easier. You had your own laptop. You weren't tuning into different computer systems that made life awkward. But people are coping, and teachers have done their best to keep schools open and to look after the students in their care. And that's what teachers do best, and we will continue to do that into the future. And I thank everybody involved in this festival, and I thank you for inviting me here today. Thank you, and I'll hand you back to Ed now.
And that's great, and not least for observing the time. It's great to hear those, that such in-depth detail from the front line and what it feels like in the day-to-day challenges that are faced by teachers in the classroom and by the wider movement as a whole. But now it'll give me great pleasure to move to our second speaker, Phil Ni Sheaghdha, as well known to most of you, I imagine, as the General Secretary of the INMO. Phil is a nurse by background and has been, like Anne and our colleagues in the teachers' unions, very much on the front line and also, in the media, leading, pushing the debate, the political arguments that are so critical to us all at this time. So without further ado, I'd hand over to Phil. And Phil, we're delighted to have you here. And again, about 10 minutes, if that suits you, so that we can leave time for some question and answer afterwards. Phil, over to you.
Gormila Mahagat Edward, and thank you very much to the organisers for inviting me to speak at this event. And before I start, I just want to acknowledge the words of Dr Lahiff. I just think it's amazing that the wordsmith that he is can capture everything that you want to say but can't say or are unable to say. And I just think that it gives a bounce and to healthcare workers particularly in the fight against what is an absolute awful virus. To hear words like that and to see the absolute description of their work and how it's appreciated by people who live in the country. So I just want to express my gratitude for those words and the thought that went into them. I have a very short presentation which tries to set out for the audience the matters that we were asked to speak on. So I suppose we believe that unfortunately we're going to be living in our workplaces with COVID-19 for some time to come. And I just want to describe what that looks like in the health service and provision of services to those that are infected and requiring hospitalization or home care who have actually been infected with COVID-19. So next slide, please. So the first change is, I suppose everybody thinks that, you know, going to work is going to work, or some people have had to change their life and work remotely, etc. But this is what going to work looks like for nurses and midwives in the midst of a pandemic. And this is the very least protection that they need in order to ensure that they themselves do not get infected. And we know from today's statistics that the current infection rate among healthcare workers, and these are the infection rates that have been confirmed, is just over 11,763. So that means that if you work in the health service, you are going to be at very high risk of being infected. And in fact, that figure has continued to increase despite the reduction of the general population infection rate. And we have been advocating and requesting of the health service that general widespread testing of those that work in the health service, particularly those that work in COVID positive areas, should happen ahead of an outbreak. So in the last 24 hours, we've had recorded outbreaks in 6 acute hospitals, and the total number of workers who are now absent is 560 just from those 6 sites, and widespread testing was not available prior to the outbreak. So we believe this is the wrong way to do it. We're chasing the COVID testing as opposed to the testing teaching us and demonstrating how we should be securing the infection and infection control. So the next slide just sets out in general terms the workers' perspective across the trade union movement. I think we worked very fast through the Congress of Trade Unions to bring matters that would be of central importance to workers dealing with a pathogen that infects the body, and then you have to work in that environment with that fear constantly. This presentation sets out the general collective trade union position, the protocol that was agreed for those that were not at work and then returning to work, the central importance of the Health and Safety Authority as the statutory body with responsibility for worker safety, and then healthcare workers. So next slide, please. This is the document which is titled No Going Back. It's a document that all unions affiliated to the Congress of Trade Unions inputted into and sets out for government the asks and the requirements in each sector. So for example, in health, we know what we're looking for in respect of the health service. We're looking for a universal public healthcare system free at the point of use. That's the mantra, that's the desire, that's government policy through Sláintecare. And we saw that where privately provided healthcare in the main in care of the older person services, 82% of care of the older person services in Ireland is provided through the private sector, where when the pandemic hit very quickly, that service was in need of a lot of assistance from the public sector, particularly in the area of staffing. And that obviously in the nature of the care that is being provided is very labour intensive. And when you run at the minimum constantly, any infection is going to detrimentally affect your ability to continue to provide care. So I'm not going to dwell on these slides, but this I would reference the No Going Back document, and I think that it is a very important document. It's a document that has the full support of all the Congress unions, and it forms the basis of all of the asks in each of the sectors. So the next slide sets out the education, collective bargaining and workers' rights and social welfare benefits. and the guaranteed illness benefit and income protection during a pandemic were central planks that were secured very early on through the PUP payment. We still have issues in respect of illness benefit, as you know, in the private sector is not guaranteed. That's a huge issue. Also, the status of an infection in your workplace, the status of that as an occupational injury is not secured, and we're seeking that, have sought that, and the European Union have, on the 24th of this month, the Biological Hazard Directive was transposed and should be and must be transposed by each member state into their domestic legislation for health and safety of workers. And we are anticipating that we will meet some arguments in respect of this, but the bottom line is that the country, Ireland, now as an EU member state, must ensure that our health and safety regulations reflect what that directive asks and recommends. And that is that if you are infected in the course of your work, that is an occupational injury and must be treated as such. And the risk assessment and the oversight of the Health and Safety Authority, independently of the employer, must therefore follow. And that's missing at the moment, particularly in the health service, where it is assumed, because it's a health service provider, that it will look after its workforce. And we are saying that that's not necessarily mutually exclusive. And many times we have had to argue, and successfully argued very early on in this pandemic, for the right of healthcare workers to wear face masks. On the 22nd of April, that was successfully translated into a policy following our negotiations with the health service. But prior to that, some of our members had been instructed not to wear face masks. And as we get to know more about COVID-19, we know that asymptomatic presentation led to infection. So it wasn't just those with temperatures who were infectious. In fact, many were infectious without symptoms. Next slide, please. Again, these are the entirety of the no going back document. And again, I would reference the ICTU web page, and where the full text of all of this document is available. So next slide, please. So the bottom line from those that work in society is the exposure to COVID-19 is a public health risk which affects all citizens, in fact, is affecting not just citizens, but anybody who is entering your country, and therefore it has huge implications for workplaces, and particularly those that provide care to people who are infected with the COVID-19 pathogen. So the very central important piece is when you are and when you need to provide care and very, very rapid care, worker protection in the provision of that care should be and must be guaranteed. The Health and Safety Authority, it is clear, it is our view. I think that view is widely shared, and I think the EU directive confirms that the authorities that are entrusted statutorily with responsibility for health and safety at workers must take responsibility for infections that arise from COVID-19, and public health advice and funding for our health services obviously have also been hugely to the forefront of trying to provide sufficient PPE to ensure that, for example, where you don't have a workforce that matches the need, that is supplemented. And these are hugely important issues, and they're ongoing daily battles. Next slide, please. The ICTU, through representations and with the Department of Business, Enterprise and Innovation, have secured this return to work safety protocol. This centralises the role of safety representatives at local workplaces to ensure that risk assessments are undertaken to provide for a mechanism of determining if workplaces are safe with the frontline worker involvement. And again, this is a document that took a lot of negotiation and had input from the trade union movement. Next slide, please. This protocol's main points are to support employers and workers to put measures in place to prevent the spread of COVID-19 in workplaces. The protocol should be used by all workplaces. Is its introduction to adapt their workplace procedures and practices to comply fully with public health protective measures identified as necessary, and the collaborative effort of the Health and Safety Authority, the Health Service Executive and the Department of Health. The protocol was developed following discussions and agreement at the Labour Employer Economic Forum, which is a forum for high-level dialogue between government, trade unions and employers. And again, as the advice issued by NEFID continue to evolve, this protocol and the measures employers and workers need to address are changing and continue to change. Next slide, please. The Congress of Trade Unions and our health and safety representatives have developed the complaints procedure, so that the worker representative has a system whereby matters can be raised very quickly that need to be addressed. And we have issued this to members who work in the front line. And this is important because we have to have consistency across all workplaces, but most particularly where issues have tended to be slower being resolved. And that leads in the situation where you're dealing with an infection like COVID to very serious consequences as a result. Next slide, please. As I said earlier, the Health and Safety Authority in Ireland is the body, the statutory body, that's function is to promote and encourage and foster the prevention of accidents, dangerous occurrences and personal injuries at work in accordance with the relevant statutory provisions. And I'm just setting out there what the Health and Safety Authority's definition of accident and personal injury includes. And it's clear that from an accident, it means an accident arising out of or in the course of employment, which in the case of a person carrying out work results in personal injury. And personal injury includes any injury, disease, disability, occupational illness, or any impairment of physical or mental condition or death that is attributable to work. And the next slide shows that as that is the definition, and technically speaking, one would assume that COVID-19 falls into that. Unfortunately, regulations that were introduced in 2016, Regulation 224, further define the term personal injury as not including any disease, occupational illness, or any impairment of mental condition. And this is the issue that we believe is central to the trade union lobbying at the moment. And the European Directive that was transposed on the 24th of this month should help in respect of making this very clear. We have conducted a survey across all European countries in conjunction with our trade union colleagues in other nursing unions. And out of the current 24 member states who have responded to that survey, not all, and Ireland is among them, not all group, consider and treat an infection of a healthcare worker as an occupational injury. We're one of 7 countries that don't, but the remainder do, and have a classification that it is in fact an occupational injury. And we are seeking that the European Union now intervene, and considering the directive has been transposed, that they would insist that all European countries have the same description and treat COVID-19 for their workforces who are meeting it in the front line head on a daily basis in the same way. The next slide, please.
Phil, I was just wondering, would that be a good time to kind of make a break? Would that be rude? Are you almost there?
Yeah, I think I'm just setting out the numbers of infections.
Sure, no,
so
please
I can speed through these. So across the healthcare worker roles, this is what the infection rate looks like at the moment, and this is up to the 14th of November. And that is very, very high percentages. Healthcare assistants and nurses, who are the two grades that are, I suppose, closest to the bedside, if you want, have the highest infection rate. Next slide, please. And again, this is just giving you an overview of the total number of cases. So as I said, 11,675 total cases in healthcare workers, and that is increasing. And that is the 22nd of the 11th, that's the latest figure. So out of a total cases in the general population of 70,000. Next slide, please. So I suppose I just have, these are the final slides, which are testimonies from nurses who are working in the front line. They've sent us photographs of what their daily work entails, what it looks like. And also they say the biggest challenge is wearing the PPE. Wearing PPE for long shifts is exhausting. It's very warm. It's very difficult to breathe properly. It's very difficult to get hydrated. And because we're short-staffed to begin with, the difficulty is getting relief to take breaks. And that is a very real problem. And that is leading to, according to the WHO, an increased infection rate among healthcare workers because of fatigue on the job. Next slide, please. The general feeling of nervousness was very much an issue when we started dealing with the pandemic. However, as people got used to it, they did describe it as being easier to deal with once you were confident that your PPE was being donned and doffed properly, and that required a lot of intense education and intense peer support. Next slide, please. I think this is the final slide. This is a patient. She was being discharged from ICU that day, and she is applauding the healthcare workers that looked after her. And I think the real good news story from Ireland is that our discharge rate from intensive care is very, very impressive. And that's because of the very good care that those patients got. It required intense scrutiny of how care was provided, nursing patients on the term that's being used, as you know, is nursing patients prone. So you nurse somebody who is on a ventilator on their stomach, which is very, very difficult. You have to turn and you have to make sure that your care delivery is observed in a different way. And it is undoubtedly hugely significant that all of that care was taken, all of those new ways of working and nursing patients were undertaken, and the proof is in the discharge rate from our ICUs, which is impressive. And that, I think, is the most important message that I want to give this symposium is nurses and midwives going to work, all healthcare workers going to work, didn't flinch. They went into the eye of the storm, they met it head on, and they adapted their practices to get the best results. And I think the President of Ireland put it very well when he said, let's not forget what sacrifices have been made, and let's ensure that we value that, and we value that caring role in a manner that we haven't done to date. So I'll leave it at that, Gurmila Mahagav, and I'm very happy to take questions.
Phil, again, great detail, really stops us in our tracks when we hear about some of the challenges by healthcare workers, and of course also what strikes me in particular is the wider challenges that you referenced, the gaps and weaknesses in our social policy, in our regulation, in our legislation, the fact that certain groups of workers don't have access to paid leave. Childcare arrangements, which you didn't dwell on that much, but I mean, I know has been a huge issue, particularly gendered issue as well. I'm aware of it in my own work, and I know for all of the frontline groups, these are really, really big issues challenging us all. I'm conscious of time, And I know we have a few questions coming in from our audience. We're aware that there's lots of people joining us out there from all over. Great to have you with us. I won't be able to acknowledge you by name, but if I could go to the first question, and I'm not sure whether Anne or Phil would like to respond to this. It's about the notion of solidarity. Can I ask how we in the trade union movement can reignite the notion of solidarity that has been so eroded by neoliberalism? Is there a chance that the social solidarity required in our response to COVID might help with this? I could take maybe a brief response from either or both of you. Anne, would you like to come in? Maybe, yeah, first, and I can go back to Phil then as well. Thank you.
Sorry, the first thing is to get as many members as possible to join a union, to join their own unions. That's the first thing. Even at the moment, I suppose, with teachers, and I would expect across other areas, we have a lot of meetings with our counterparts in the TUI and the INTO, and even IFUT on occasion. ICTU always does a great job of threading and knitting people together, and that has not changed. Sometimes in public, be it on the media or in newspapers, they tend to drive the wedge. So, for example, they often pit teachers against nurses. You know, look at what the nurses are doing compared to ye, is one thing we would often get. And often as well, what they try and do is pit a wedge between the members and the union itself. And I think the public have to be aware of that, and the members have to be aware of that, and they have to see that might be done on purpose to make unions weaker. The stronger the union, the better conditions will be for workers overall. And it's not even between Irish groups of workers working together. It's the workers down south, the workers in the north, the workers in England, the workers in Europe, and the workers in the world. And by unionising the world, we can help each other. And there is a certain amount of that going on already. Thank you.
Thanks. Ed,
sorry, thanks, Phil. Sorry, thank you. You may go ahead.
Again, yeah, I agree with a lot of what Anne said. I think the important point is that trade unions moved quickly to ensure that workers' rights were protected. You're right. One of the big issues was the role of female workers, I think. We know now, for example, in Ireland, there are more women in trade unions than men. And we know that during this pandemic, there were more women at work and in dangerous occupations than men. And we also know that childcare was a real issue, wasn't available when schools closed, when childcare, you know, when the public health advice was close schools, close childcare facilities, but healthcare workers still had to go to work and they had real issues with their childcare. Working from home simply wasn't an option. And it was too late when that issue became something that the government looked at despite the constant lobbying. And that's what we're saying all of the time, that when it comes to issues that are important to workers, the trade unions have to ensure that they are out and articulating those issues as early as possible and ensuring that all workers support the cause. I think that it will be one of the benefits. I think solidarity across the workforce was visible. I think, you know, a lot of people have lost their jobs during this pandemic. A lot of other people have got very sick, and some people, unfortunately, have lost their lives because of the job they do. And I think we have to work together as one unit, and I think we will, in ensuring that the protections that are needed are put in place, whether that's payments, whether that is part payments from government and employers to ensure incomes are maintained, and to ensure that that thread and your connection to work is maintained. That's really important. And I think that those matters were very, very important to the trade union movement as a whole.
Thanks so much, Phil and Anne. John Barrymore, I know you're out there. I'm kind of losing sight of the questions. I don't know if you have access to the question. Would you like to lead us on what's in the chat box?
Thank you, Edward. So this comment came in from the United States, And it says, as a college professor married to a health professional, thank you, all capital letters, for putting together this great and needed event. Okay, so let me go to a question here. This I think would go to Anne. Really, or actually, it may have a healthcare issue too. But it says, if there is an outbreak of COVID-19 in a workplace, say school, are the workers, parents, pupils immediately informed, or is GDR being used to not immediately tell people?
Thank you. I think we can even take the word immediate out of that. Nobody is told. The teachers go in every day, they don't know. The student might be missing, they don't know. Are they sick in another way? Is something wrong at home? Or have they been a positive case or a close contact? Nobody is told. Now, we can understand that we don't want individual people named, and they totally have a right to their, to having their own personal rights protected like that. But if there is an outbreak in a school, I think it would be good for people to know without knowing who it is, and nobody really is informed. The student themselves obviously knows. Any close contacts might subsequently be told following a risk assessment, but we have loads of examples of positive cases where nobody is deemed a close contact afterwards, and that is really what worries teachers. And the other issue that worries teachers is if a student is sent home from school and is a positive case, well, then that is registered as a school case. But if a student goes home and is sick all day really and says nothing, but at 4:30 in the evening, if their parent takes them to the doctor and they then are positive, that may not be counted as a school case. And that's very worrying for us. We would like to know exactly what the numbers are of our students. So nobody is told is the point, and we would like to be.
Okay.
Yeah, great. Thanks very much, Anne. Phil, I have a last question in the box, and I might direct it towards you. Thanks very much, if that's okay, just to keep it moving along, and then we would probably have to leave it at this point. The question is, the current crisis presents as an opportunity for the public sphere and public servants to be revalued and reimagined. How will unions advance this vision for the public sphere in the midst of future efforts with the usual arguments for rationalization, or re-establish another wave of neoliberal reforms? Is that something you would be able to guide us on?
Yeah, well, I think it's a good question, and I think the important point is, for example, as I said earlier, you know, the whole focus of the public service in healthcare and successive agreements that have brought, you know, since 2010, 2011, since the crash, have been on austerity, have been on cutting back on public service employment, have been on reducing the value of the public service job, etc., etc. So I think that public servants stood the test of this pandemic insofar as we were organised quickly, we provided the care that was needed, and we performed quite well, in particular in relation to keeping people as well as possible during a pandemic. And I think that public service has always been a part and parcel of delivery of services to the public. And I think that unless it's invested in, that will not happen. And I think that particularly outsourcing to the private sector, because it's cheaper without regulation, we've seen what's happened. We've seen what's happened in screening. We've seen what's happened in private provision of, unfortunately, in care of the older person services during COVID. They're just examples. But if we are to learn anything from this pandemic, it is that prior to deciding that it's cheaper to provide this service in a different way, you have to look at the quality and you have to look at what's best. And I think the public service has proven that it provides services during a pandemic, as we have done, and we have performed on a global scale very, very well in doing that. Now, we have to look after those who provide that service and ensure that they are not being sacrificed. And that's why we will continue to campaign for worker health and safety, and particularly the inclusion of the infection of COVID-19 as an occupational injury. If you are at work and you are infected, it is an occupational injury. There's no other explanation, there's no other description. And that's going to continue to be our campaign.
That's fantastic, Phil. Thank you so much. I think where we are with time, really all I can do is again thank our speakers, and Piggott and Phil Ni. Thank you so much for such a lively contribution.
My pleasure.
For stimulating us all, you know, with these big, the little issues, the issues that trip us up every day, and the big societal and political wide issues. It's great to know we have such a dynamic labour movement out there, doing so much for us all, with us all, in a spirit of solidarity. And if anything, this pandemic has taught us many things, but it really, in the spirit of Mother Jones, I would just like to say it has reminded us, you know, how much we depend on each other, but not just nationally. If there was ever a global crisis, this is it, and there has never been a greater time for global solidarity. So hopefully we're moving back into a slightly better space when it comes to global solidarity. I think that's something that Mother Jones would appreciate. So I think I'd better hand back to John, and maybe we'll have a few final words to sign us out. So thank you, everybody. Back to you, John.
Thank you, Ed.
So hello, everybody. I'd really like to thank Edward for moderating, and you did a just outstanding job. Phil and Ann, thank you so much for your contributions. You know, gave me a lot to think about, and you know, you lived up to the Mother Jones Festival of having thought-provoking, challenging ideas, and so thank you very much for that. And I'd just like to take a moment, because this is American Thanksgiving this weekend here. So, I mean, one of the things I'm really thankful for is that the frontline workers, the educators, the nurses, the people who are at the bedside, and thank you for showing that, Phil, that, you know, that disparity between doctors and nurses with the risk factor was mind-boggling to me. So, you know, my thanks to everybody who's doing this work, and we'd be lost without it, you know. So they're really living the ideal of Mother Jones in so many ways, because she was somebody who was not afraid to stare down a gun barrel, you know, to stand in the way of the strikers and the militias. So keep fighting the good fight, and thank you for that. Just a few words, you know, to the people who stuck with us in the audience. Thank you so much for being here and attending this event. And again, this coincides with the 90th anniversary of Mother Jones' death, but it's through work like this that her spirit continues on. So that's a wonderful thing. And remember that the festival does go through Monday, the 30th, and the full program is available in the Q&A stream. At the very beginning, there's an announcement there, and there's a talk coming up at 7:30, which I believe is Ann Toomey, who's an historian. And so you can find, you know, your way to the other events there. There's a Facebook page for Mother Jones Cork, so you can also find information on the festival there. So again, thank you for seeing us through this here, because this is a challenging time for everybody, and trying to be able to deliver, you know, some sense of normality in the midst of the pandemic. So thank you for being part of the audience, and the presenters, thank you again.
Thanks very much.
So good evening, everybody.
Thank you, John.